I'm Rachel Rubin Green. This is my 29th year teaching at Culver City High School.
My name is Ms. Bracco, and I'm the new 9th grade health teacher here at Culver City High School. I came from New Jersey, where I taught middle school health and phys ed for the last 10 years.
I've taught health 3 or 4 different years, all within the last 8 or 9 years of working here. I'm required to teach birth control methods in addition to abstinence. That's something that is in the California state standards. I'm also required to teach about sexually transmitted infections. Within that spectrum, I have a lot of flexibility.
We have a little bit of control. We can pick and choose how we want to teach it, but we are required to cover a certain amount, certain age levels, and the kids should be mastering some material by certain times.
Is that different from how it was in New Jersey?
No, it's pretty much the same. You get a curriculum that you're required to teach per grade level, and so you just try to get done what's expected to get done in the best way you can. I think the sex ed content for the current curriculum is pretty good. It's pretty extensive, and I feel that it's very important that the students are learning and understanding what's out there and how it affects their sexuality, their behaviors, their decisions. So I would say the content here is pretty thorough.
We're so concerned with risk, we're not teaching the communication skills that are really, really important. The actual communication skills, it would be nice to have somebody from the guidance office come in and address that. The best way to teach sex education is to teach it with a whole lot less hesitation than even I, with all my years of experience, can bring to it.
I think just having a variety of teaching styles, using visuals like PowerPoints, some hands-on activities. We did some hands-on with contraceptives, passing things around so the kids can see. There's just a lot of different learning styles, so having a visual, having a hands-on group work, a little bit of lecture, I think all plays a part in the whole process of sex education.
When it comes to sexuality and birth control, I want students to know how to find birth control devices and how to get reliable information. And so the health center here at Culver High has a kit of different birth control methods, and I'm able to demonstrate a number of them in terms of just showing what a diaphragm looks like, how to put on a condom, what a female condom looks like.
I have a question box over there that I let them put questions in, that things they want to know.
What's most important to me is there's a double lesson, a lesson that takes 2 class periods, where students research different birth control devices on the Planned Parenthood website. And to me, if one of the 3 or 4 things a student remembers forever is that when they need sexuality information, they should go to the Planned Parenthood website, that's important. That's what I want.
I don't really find too many difficult parts. I like to teach it. I like that the students are curious.
Our culture brings so much emotion and so many values and so much anxiety to the discussion of sexuality that it's really hard for even teachers and even very experienced teachers to completely sidestep that.
I just feel that somebody has to teach them, and if they're curious, we should help them, at least lead them in a direction to find out the information, or explain it to them ourselves. But I don't find too many things difficult about teaching sex ed. It's kind of fun, actually.